Chad's here with NSU, and I'm going to do a physical assessment on you. Is that okay? Okay, great. Can you tell me your name? Oh, vital signs have been obtained, and I provided the patient privacy. Can you tell me your name and date of birth?
Alexis Dossier.
Okay, and I'll double check that. Perfect, that matches.
My date of birth is 4/8/03.
Oh, thank you. So name and date of birth matches. I'm gonna go ahead and raise your bed for you, okay? That way I can protect my back while I'm doing this. So Alexia, do you know where you are right now?
The hospital.
The hospital? Okay. And do you know what day it is?
Wednesday.
Wednesday? Okay. So the patient is alert and oriented ×4 to person, place, time, and situation. Do you have any allergies?
No.
Okay. How did you sleep last night?
Well,
Okay, good. And what did you have for breakfast? How was your appetite?
it was good.
Good. Okay, that's great. Did you have any problems swallowing? No. Okay, good. So what brings you into the hospital today?
I've been having some pain in my lower belly.
In your lower belly? Okay, well let's talk about that. So did this pain come on suddenly, or was it kind of a gradual?
It was kind of a gradual.
Gradual? Okay. And show me exactly the location of your pain. Right there, lower left? Okay. And how long have you had the pain?
For about 3 days now.
3 days? Okay. OLD. Can you describe it? How would you characterize the pain?
It's not like a throbbing pain. It's whenever I go from laying down to sitting up. It's like a strain almost.
Okay, a strain. So is that, would you say that's what aggravates it, or are there other things that aggravate it?
What aggravates it, like moving position.
Okay, what helps it feel better, if anything?
I've been taking Tylenol, ibuprofen. I've been rotating that.
Okay. LDCA. Does it radiate anywhere? Or it just stays in
It
that
just
one?
stays.
Okay, and I know you said you've been taking Tylenol and ibuprofen. Are there any other at-home treatments you've been doing? Just that? Okay. And if you had to rank it on a scale of 0 to 10, 10 being the worst pain you've ever experienced, how would you say this pain is?
Probably a 4.
A 4? Okay, okay. Alright, well, I'm sorry to hear that you're in pain. I'm going to go ahead and do this physical assessment and check the rest of you. I'm going to raise the head up, okay? First, I will assess your eyes and check the rest of your cranial nerves, okay? So I'm actually going to have you remove your glasses. I'm just going to check your pupils first. Well, how many fingers am I holding up? 2. Okay, perfect. Now I'll check your pupils. So just look straight ahead. Okay, great. So, and then continue looking at that IV. What is it called? Hanger? I don't know. And okay, and now look at the tip of my pen. Okay, great. So your pupils are perla, which means their pupils are equal and reactive to round and reactive to light and accommodation. You can put your glasses back on. Now I'm going to ask you to follow the tip of my pen with just your eyes, and I'll check your 6 cardinal fields of gaze. Okay, perfect. So I have assessed cranial nerves 2, 3, 4, and 6. Now I'm going to ask you to clench your teeth down and smile, raise your eyebrows, and puff out your cheeks. Okay, so cranial nerves 5 and 7 look good. You put gloves on while I look at your mouth. So just inspecting, your lips look like they're appropriate color and moisture. They're pink. Go ahead and open up. So I see she has all of her teeth. Let me just check with my pen light. I don't see any lesions. Stick your tongue out and say ah. Okay, her uvula rises. Her soft palate also rises symmetrically. mucous membranes are moist and pink. Will you stick your tongue out again and wiggle it side to side and lift it up? Okay, great. I see no, I see no lateral deviation, and your blood vessels look very healthy. I'm just trying to make sure that there's nothing else I need to check with your mouth, but I think that's pretty much it. So I also need to assess your, hold on, let me just think for a second. So, okay, well, before I move on, let me just say I've also assessed cranial nerve number 10 because I asked earlier if you had any difficulty swallowing and you said no. Cranial nerve 8 has also been assessed because you haven't asked me to repeat myself, so I know that you can hear me appropriately. I'm going to check your gag reflex. Stick your tongue out, and your gag reflexes, great. Okay, now I'll assess the remainder of your cranial nerves and have you push against my resistance. Sorry, I know that was not sanitary. So, okay, go ahead and push against my resistance. Okay, and the other side and push up. Okay, so all of your cranial nerves have been assessed, I believe, and everything looks good. So I'm going to move on, and now I'm going to listen to your lungs. So I'll be listening, well, first I'm going to inspect. I can see that both sides of your chest rise and fall symmetrically, breathing appears to be even and unlabored. So I'm going to listen to your lungs. Just breathe in and out through your mouth. Each time I move my stethoscope, take a deep breath. You don't actually have, I'm going faster than. Okay, breath sounds are clear. Bilaterally, I didn't hear any crackles. I'm gonna ask you to sit up all the way, and I'll listen to the back of your lungs. Go ahead and give yourself a big hug, and tuck your chin forward. Okay. And I'll get the lateral lobes on the right side. Okay, and breath sounds, you can relax, are clear, breathing is even and unlabored. And now I will listen to your heart. So are you comfortable in this position, or do you want me to lay you back a little bit? Okay, so I'm going to listen to the different valves of your heart, starting with aortic, pulmonic, herbs, tricuspid, and mitral. So S1 and S2 is heard distinctly. Your heartbeat is regular rhythm. Strong heartbeat, I would say it's about 60 beats per minute. And I've also inspected the chest. I don't see any on the precordium, no visible palpations, anything abnormal. Everything looks great. So I'm gonna leave the stethoscope on because I will be inspecting your abdomen. But actually, before I inspect your abdomen, I'm gonna check your back just so I don't forget. So now I'm gonna lay you down. And then I'm trying to think if I have forgotten anything. Well, while I'm thinking about it, since we're going to be looking at your belly, have you had any problems urinating or any problems with your bowel movements? Okay. And when was your last bowel movement? Yesterday? Okay, great. So I'll roll you toward me while I check your back. Go ahead and do this, and I'll roll you, move your shoulder and your hip. I got you, so you won't be falling off. I'm checking the scalp, shoulder blades, coccyx all the way down to the heels for any sign of skin breakdown, redness, any abnormalities. Everything looks great. I didn't see any ecchymosis, anything out of the ordinary. So now, first I'm inspecting your abdomen. I'm going to ask you to lift up and do a little crunch, and I'll check for hernia. Perfect, okay, I don't see any signs of a hernia. Your umbilicus is inverted and looks normal and healthy. I'm also checking for any ecchymosis, any unusual venous patterns, pulsations. Everything looks normal. So now I'm going to auscultate. I'm starting in the right lower quadrant, moving to right upper, left upper, and then left lower quadrant. And I was listening for bowel sounds, which are active at the rate of between 5 to 35 sounds per minute. So next, I'm going to remove this stethoscope, and I will percuss your abdomen now, going in the same order quadrant, starting at the right lower, going to right upper, left upper, and then left lower, and I'm checking for tympani. Now I'm going to palpate your abdomen, moving in the same order, and this I'm checking for texture, temperature, tenderness, moisture, edema, and nodules, which I don't see any of. Everything looks great. So we'll move on to your extremities. I'll start with your arms. So on your arms, I'm going to check the temperature, which feels normal. Your skin is an appropriate color for your ethnicity and looks like it's nice and dry, an appropriate level of moisture. I'm also going to give a little poke on both sides, or excuse me, a pinch, checking for turgor, and a poke, checking for edema, which looks good. Now I'll have you push up against my arm to assess your strength. This side, okay, great. Go ahead and squeeze my fingers as hard as you can. Okay, grip strength is even bilaterally, you can relax. I'm going to assess the capillary refill on both of your hands, which is less than 3 seconds bilaterally, and I'll feel for your radial pulse, which is +2 bilaterally. The rate is about 60 beats per minute and is strong, and the rhythm is regular. And now I'm going to go ahead and assess your lower extremities. So same thing that I did on the arms. I'm assessing for temperature, texture, tenderness, moisture, edema, and nodules. So temperature feels appropriate, not too warm or too cool, and it's equal bilaterally. I'm going to assess for turgor by poking, or excuse me, pinching the skin, and then edema by giving a poke. And I'm going to check the capillary refill of the toes, which is less than 3 seconds bilaterally. Go ahead and push against my resistance. And on the other side, okay, that strength appears normal, and then push up, okay, and down. Okay, great. So the strength is even bilaterally. I'm going to assess the dorsalis pedis pulse, which is +2 bilaterally. The rate is about 60 beats per minute and feels strong and regular rhythm. And just trying to make sure I hit everything. I think so. So now I'm just wrapping up the assessment, so I'm going to go ahead and check everything that's connected to you, any IVs. Would you like me to sit you back up so you're in a more comfortable position? Okay, I'll sit you up, and then I'll lower the bed down as well for safety. The side rails are also both up for safety. Do you need to use the restroom? Okay, what's your pain level right now?
Probably still at a 4.
Still a 4? Okay. I'm going to make sure that you have your call light within proximity to you, as well as any personal belongings that you might want, your phone, remote, anything anything like that. Let me just think really fast to make sure I got everything. Okay, I think we're okay. We'll see, I guess. Okay, so I'll be back in about 30 minutes once I speak to the doctor and get you some medicine. And okay, thank you so much.
Thank you.